Hi everybody, it's Dr. Hall. We're going to shift gears now, going into Unit 7, which is communicable diseases. This is the first of two parts. So just to remind you, communicable diseases are things that are infectious or contagious. They are caused by germs. They can be transmitted from one person to another. And this is just an outline of what we're going to talk about in this unit. This first part is going to focus on these general concepts of burden, routes of transmission, identifying the contributory cause, and the potential impact of any one communicable disease. And then part 2, we're going to talk about tools and strategy. So first, we're going to talk about the burden and what are the ways that we kind of ascertain how important or prevalent or what degree of problem these conditions are causing. So we've looked at this data before, and so we'll just come back to it again because I love these visualizations. Let me get my highlighter here. So in terms of causes of death, this is globally, right? So here are our infectious or communicable diseases over here. A sizable chunk, right? The vast majority are those non-communicable diseases that we talked about last unit. But if we look at disability-adjusted life years, so in terms of the suffering that they cause or the premature deaths that they cause, we see it's a bit bigger chunk. So this is a really significant piece of the health and wellness of a population is the burden of communicable diseases. And if we look at countries that have a low social developmental index, so countries that tend to be poorer or have fewer resources, less infrastructure, fewer systems in place for public health and medical care, we see a huge impact of communicable diseases in disability adjusted life years. So this is huge in many, many parts of the world. So if we look at lower to middle income countries, so that's what we're looking at here. So let me show you a couple of things about this. So first is that the open circles tell us the year 2000, and the filled in circles are the year 2019. So that's the first thing I want to orient you to. The second thing is that blue are non-communicable diseases, things like ischemic heart disease, which is atherosclerosis, and stroke, which is atherosclerosis in the brain, and then communicable diseases, which is what we're talking about with this unit. And then they've also included injuries. So we can see that in lower to middle income countries, still we see those non-communicable diseases of heart disease and stroke as the big two, but then we see neonatal conditions. These are communicable diseases. These are infections in infants. Okay, so these are infections in newborns. Then number 4 is lung disease from smoking. But then number 5 is lower respiratory infections or pneumonias. And this was before COVID, right? This is going. And diarrheal diseases are actually huge causes of death in many countries in the world, as is tuberculosis, which is something that we see very little of in most parts of the United States. All right, so these are really important. And if we look at the lowest income countries, we're going to see that the leading causes of death, 1 and 2, are infections. So those perinatal, neonatal, newborn infections that happen, and then pneumonias. And then diarrheal diseases, malaria makes the list, tuberculosis, and HIV and AIDS. So we can see that these are very important in many regions of the world. But you can also see another thing here, which is pretty cool, which is that we are making an impact. So these happen to be absolute numbers of death. They're not rates per population. So I have a little bit of a bone to pick with whoever created these. However, these are countries in which the population has only expanded. So it's fine. It works out okay. But if we look at improvements in lower respiratory infections, significant decrease in deaths due to these, diarrheal diseases, significant decrease, malaria, significant decrease, HIV, AIDS, significant decrease. Like, these are huge success stories. So this is like, congratulations to all the public health workers and sanitation workers and city planners and everyone working on those social determinants of health, working on medical care. All types of things go into these astounding improvements that have been made all around the world. And in reality, it wasn't that long ago that the United States looked more like these other countries. So let me give you an example. So these are deaths due to infectious disease in the United States, starting in 1900 and going through the year 2000. And so it used to be that infectious diseases were about 800 per 100,000 population per year. So I like this because it's controlled for the population, which is very important because our population has exploded over the last century. But anyway, let's look at some of the major developments and the impact that it had. So formation of state health departments. This is public health coming on the scene in the beginning of the 1900s and saying, hey, I think there's things we can do to reduce burden of disease. And as you'll remember when we talked about the history of public health, early on it was mostly about infectious disease. And so we saw some improvements starting to happen. And then look, first use of chlorine to disinfect drinking water in the United States, right? So huge improvement. And then we had a really bad influenza pandemic in 1918, 1919. Lots of people died. It was horrible. It was also during World War I, which didn't help. But anyway, so we had a bump there. We eliminated plague from the United States. So that's pretty good. Then we discovered penicillin and antibiotics, and that really helped. And then the Salk vaccine this is the first vaccine for polio. And so all of these different things conspired to bring down the deaths due to infectious disease. And we were doing really, really well. And then you see we had the start of the AIDS epidemic in the 1980s. And so deaths due to infectious disease started to go up again. They then came down as we got good at treating HIV. And then most recently, oh, they're up. Okay, so let me show you what this graph is. I'm reading my glasses. Okay, so this is data from the CDC looking at total deaths in the United States, in the entire country, per week. So that's what this is. I know it's hard to read the legend because the graphics are weird. So what we're looking at, each one of these little bars, let's see, let me get myself a laser pointer so you can see. Each one of these little, can you see that? I don't know. No, hold on. Okay, all right. Each one of these little bars is a week. And so what we are seeing, so down here, this is January of 2018, April 2018. January, yep, okay. Here's January 2019. There we go. All right. And then here is January 2020. Okay. So the first thing I want you to notice is this orange line. So this orange line here is the average number of expected weekly deaths in the country. Now this is based on our population rate and historical data. They use that to predict and model how many deaths we would expect to have. Now you might be like, why do they go up and come down and go up and come down and go up and come down? The reason is influenza. So actually most winters, past few years have been weird, but most winters we have influenza going throughout the country. And tens of thousands of people die from influenza every year. So we expect to see an increase in death rates every winter, and then it comes down, and then an increase in death rates in the winter, and then it comes down every single year. That's just how it goes. That's how it happens. So what you can see is that there's generally between 50 and 60,000 deaths per week on average in the United States, and this is from all causes. So regardless of cause of death, these are just total numbers of deaths from all causes. So here is April 2020, right? Boom, all of a sudden way more deaths than we would normally see. Started to taper off a little bit, then a hump, and then the next winter, huge. And then it came down again. This was our hot vax summer, and then it came up again, and then up. And then here we are now. So we're still seeing higher than average higher than expected death rates, and this is due to COVID. Okay, so these are termed excess deaths. These are deaths that we would not have expected to have, so something different is going on than what usually occurs. And almost all of these excess deaths were due to COVID. Some of them are due to overwhelmed health systems. So you might remember when the hospitals were completely swamped and overrun and there was no room for anybody. Even here locally, we had people that needed to be hospitalized. There were no beds. Even in Eau Claire, they opened up the parking garage at the Mayo Hospital for a while to try to put some people in there. Ambulances were having to drive people for hours to find a hospital that had room for them. And so some people died because of not being able to access healthcare because the healthcare system was overwhelmed. So if you remember talking about flattening the curve, we were trying to prevent overwhelm of the healthcare system. And that's also the reason, remember I mentioned when people say, well, what's it to you if I get vaccinated or not? I'm the one who would get really sick if I don't. It's like, well, the difference it makes to me is that if a whole bunch of people don't get vaccinated and get really sick all at the same time, then maybe the hospital isn't going to be there for me when I'm having a heart attack or get in a car accident, right? So yeah. The other causes of deaths, we did see an increase of deaths due to drug overdose and drug abuse. And that's multiple factors we think have probably contributed to that, including the fact that a lot of drug treatment programs shut down during the pandemic, right? Because people were doing everything completely remotely. People didn't have access to drug treatment centers and other social supports the way they had had previously. And so that was pretty devastating. If we look at the COVID death rates specifically, so this is looking at COVID-19 deaths. Now, let me be clear. These deaths shown on this graph are deaths due to COVID, not people who died with COVID. These are people whose precipitating cause of death was the COVID infection itself, because we specify that on our death certificates. And so this is data compiled from death certificates. So remember our sources of data from a previous lecture, the 7 S's, and one is statistics, vital statistics like death certificates, birth certificates, those types of things. This is data from death certificates. The black line is total number of COVID deaths, right, by the month, right? You can see it's averaged out by the week. And then the different colors here are the ages. So this top line, these are the oldest people. So these are people in their 80s and upper 70s. And then, let's see, where's my age group? Down here. Right? So we can see that older people were disproportionately impacted by COVID-19. They were more at risk of death. So this is that same graph I showed you before, looking at total deaths in the United States. And we see all these excess deaths far above what we would normally expect to see and still higher than normal deaths. So we have this new infectious disease on the scene and it is still causing significant harm. And then I thought it would be interesting to look at Wisconsin. So we can see this is just for the state of Wisconsin specifically down here. And you can see that although right when the pandemic hit, right, there were a huge spike in deaths overall for the country, but Wisconsin was relatively spared for a while. It didn't really arrive here until a little bit later. And then we did pretty well that hot back summer, and then we had a surge again. And then we are doing a little bit better than the country overall, but we still are having more deaths than we would normally expect at this time of year. Right, and I just want to give you an additional update here. So you might be wondering, oh, that was only through like 2022. What about 2023? Well, it's interesting the CDC stopped actually reporting out this data in September of 2023. You might wonder why, because it's such a cool graph and it's really useful information for understanding what's going on in our country. And the answer is that their budget is finite and that a lot of the extra funding that they got during the COVID pandemic was gone. And so they have to make decisions about what work they can have their staff continuing to to do. So we only have this data through September of 2023, but I think it's pretty cool. If you look, you can see, so here was the winter of 22-23. We had a smaller spike in excess mortality than what we'd seen in the previous two COVID winters. And then you can see moving into the fall, we didn't have a lot of excess deaths, so this is good, right? Some of it is bad because the people who were going to die from COVID have now already died. So some of the reason that we don't see a lot of excess deaths is because those people already died who were more vulnerable. But of course, we also have a lot of immunity in the population now through both vaccination and previous infection and the combination thereof. So we have a much more immune population and a much less vulnerable population because unfortunately some of the people who were more vulnerable have already passed away. So that's a little update there. So another way to look at this is the causes of death compared by cause. So remember when we talked about non-communicable diseases, we talked about how heart disease and stroke, and they break them out. I talked about them together kind of as atherosclerosis and cancer, right? Those are the big ones. So heart disease is this line here. This one is cancer, and then stroke is this purple one down here. So you can see heart disease far exceeds stroke. But what we can also see is COVID-19 deaths. So at several times during the pandemic, there were so many deaths due to COVID-19 that it was actually the #1 cause of death in the United States at that time, which is exceptionally unusual for us as a country who has made that epidemiological transition from having a high burden of infectious diseases to more non-communicable diseases, to have a large numbers of our population dying from a communicable or infectious disease is very unusual. But, a new global pandemic is very unusual. And so, in fact, if you just total up causes of death for the year, so that was looking at kind of by week, you can see that in 2020, COVID was the #3 cause of death, as it was in 2021. And this is incomplete data, so again, I have a bone to pick with the people who made this graphic because we really can't compare this to the other two, but we can compare the relative contributions of the different causes of death. So COVID-19, again, is a significant cause of death in this country. It looks like it will be for 2022 as well. So we've had a very weird time of things in high social development index countries in that we've had a lot of deaths and disability adjusted life years and premature death from an infectious disease. Okay, and so here's an update when the final data is actually in. So this is from the CDC. Every year they show the leading underlying causes of death. So these are the precipitating causes of death, the things that actually kill people. And so once we got the data for all of 2022, again, here's heart disease #1, cancer in a close second. But look, unintentional injury actually became #3. If you're kind of confused and you didn't think that not that many people were dying in car accidents, that is true. Unintentional injury also includes overdoses. So we did see a lot of overdoses and car accidents, but more overdoses in 2022. And COVID actually fell to #4 in 2022. If we then look at causes of death of 2023, which is the most recent data we have available. So in 2023, things look a lot different. So again, heart disease and cancer, #1 and #2. Unintentional injuries, still #3. We have a big problem with drug overdoses in our country, and we have a lot of violence, and we always have a lot of car accidents because we drive our cars a lot. But then COVID-19 fell to #10. So still a significant cause of death in this country. It's in the top 10 for 2023, but it is #10. So this is in part due to many things, but mostly immunity in the population, which is something we're going to get to later in the lecture. So immunity from both previous infection with COVID as well as from vaccination with one of the COVID-19 vaccines. Another less sunny and happy fact is that a lot of the people who were more vulnerable, so when we think about those vulnerable populations, especially the elderly who are at risk of dying, because remember this is death from COVID-19, they already died. So we often see, interestingly, after a big pandemic, we often see a dip in mortality because the people who were kind of on track to die in the next few years already died from that infectious disease. So mostly good news, but in part because some of our most vulnerable people already succumbed to the illness and already died in previous years. Okay. If we look historically and worldwide, we will see that in most, in the world as a whole, again, this is just a different way of looking at what I showed you in the beginning with those big colored squares. Non-communicable diseases cause the most death, but communicable diseases, and here they also include nutritional diseases, are a significant contributor. But what I like about this one is you can see the change over time, right? So as places make that epidemiologic transition, let me change so you can actually see what I'm talking about. We can see that fewer and fewer people are dying of communicable diseases in the world, but we still have a lot of work to do. So this is a really important thing. It's also really important for us to keep in mind. We take a lot of this for granted in a country where communicable diseases do not, in general, most of the time, have a huge impact on our lives. But the situation is very different in different places in the world. So when we're thinking about communicable diseases in general, we want to think about who are the people who are most at risk. And so when we look at one population of people versus another, certainly we see that social developmental index, right? So countries that do not have the same levels of infrastructure, resources, sanitation systems, health services, those countries are going to have higher rates of communicable diseases just because of how these things are spread. Right? Within a population, within any population, then, assuming that everybody has kind of the same access to infrastructure and all those types of things, in general, the people who are at most risk of communicable diseases in terms of getting infected and or having severe outcomes are going to be the very young, so people who are not born yet, so fetuses, infants who are just born, and young children. Their immune systems are very immature and they have not been vaccinated yet, right? So we can't vaccinate you with everything right as soon as you are born, on the day you're born, in part because that would be mean, and in part because it just wouldn't work. Your immune system isn't developed enough, right? And it can take time to build immunity to these things. So the very young are usually at higher risk, and their organ systems aren't mature and they're weird, right? Babies are weird. And then the very old. So as we age, our immune system gets less robust, as do many systems as we age. So no different than our brains and our hearts and our musculoskeletal systems. As we age, our immune system gets less robust. There are also people who, for a variety of reasons, might have compromised or less talented, shall we say, immune systems. Now, sometimes this is because they have an autoimmune disease or some type of medical condition. Sometimes it's due to a medication that they need to take to manage a health condition, or maybe they're a transplant recipient who needs to take medications to suppress their immune system so they don't reject their transplant. So there are lots of people in the United States who have compromised immune systems. Even people with diabetes, which is very common, their immune systems don't work as well as people without diabetes. So lots of people in this country have compromised immune systems for one reason or another. Pregnant people are at increased risk. So interestingly, when you're pregnant, we'll give a little graphic here to keep you paying attention, your immune system gets suppressed so that you don't accidentally attack the baby. And things get weird with your physiology in a variety of ways that also make you more vulnerable to significant illness. People who have other medical problems. We saw this with COVID. So people who had histories of high blood pressure and heart disease and carrying excess weight were at significantly increased risk of severe illness from COVID. And those with poor social determinants of health. So people who are under-resourced, people who don't have access to care, people who are not well educated, people who live in environments that are less healthy than others, right? Those folks are at risk of but a higher likelihood of getting infected, and then if they get infected, they're at higher likelihood of having a severe outcome or getting severely ill. All right, so we tend to think of these groups, the very young, the very old, immune compromised, pregnant, people with other medical conditions, and with poor social determinants of health as these kind of vulnerable populations, people we need to think about, right? We can't just say, oh, there's a pandemic going on, you people all stay at home and the rest of us will just carry on, right? These are parts of our communities, but we need to think about them.